for sitting down with me. I'm conducting this interview on behalf of my Interpersonal Communications class at Lone Star College. So, Jimmy, where are you from?
I'm from Houston.
Okay, and have you lived here your whole life?
Sure have, except for college.
And what is your employment background?
I've been employed with South Lake Houston EMS as a paramedic for 12 years.
And what is your current title at South Lake?
It's training officer, training captain.
And how long have you held that title?
3 years.
When you started, what were your primary duties?
Just direct patient care as a paramedic. Yeah, just patient care. That's what we did. 24 hours on, and at the time, I think it was 24 on, 3 days off, and back on another 24.
Have those duties changed over time?
Well, the only thing that was added, I still do direct patient care as a paramedic, but I also do the training. So I do continuing education for all the crews and all new hires.
Did you know early on that this is what you wanted to do?
Well, not paramedic. I knew I wanted to be in medicine. I mean, I remember being 10 or 12, knowing I wanted to be a doctor. So this is where it led me.
Did a teacher or a family member, anybody close to you, influence you in any way?
No. I think I carried after my grandfather a lot, but never on the sense of medicine, because I was the first one to ever go to college in my family, so nobody had ever pursued medicine or anything.
And what degrees do you have, or certifications?
I have an associate's degree in paramedic, which is where I got my paramedic cert, and I got that from San Jack College, and then I got a bachelor's degree in business from Southwest Texas at San Marcos.
Do you plan on continuing your formal education?
Yeah, I'd like to go to nursing school and nurse practitioner.
What do you like the most about your job?
I have the freedom to go out and do. Basically, we're not supervised like somebody looking over our shoulder. We're told to go. We're given the tools to do our job. We go out, perform our job, take care of the patients, deliver them. Nobody's there telling us exactly what to do. So the freedom to do your job, freedom to just go out every day and do your thing. I mean, you don't know from day to day what to expect. You might deliver a baby that day, or you might have a bad car accident. You just don't know what you're going to get yourself into.
Well, what do you like the least about your job?
The least about the job is the prep work that goes into the job. Some of the continuing education courses can get pretty boring, and the paperwork, obviously. There's a lot of paperwork that goes along with every run.
In what situations do you feel that there might be communication pitfalls?
Well, sometimes, especially since I'm not bilingual, the Spanish-speaking patients can be sometimes difficult. I say Spanish-speaking. I ran across a few that it wasn't Spanish. It might have been Chinese or another foreign language. But anytime you encounter somebody that doesn't speak English, it poses a difficulty there. We get around that by one, my partner sometimes speaks Spanish, depending on who my partner is. And two, we have a line we can call back to the 911 dispatcher, and they always have somebody that can translate.
What do you feel are your personal communication strengths?
Related to medicine, I think I've learned over time how to communicate very quickly with the patient and determine what the problem is without having without adding leading questions where they ramble. It's direct questions, get the patient to answer your questions so we can treat them rapidly instead of lingering.
Do you feel that you have any, aside from not being bilingual, do you have any other communication weaknesses?
Can't think of any offhand, no.
Have you had any cultural competency training to help you deal with individuals that are from a different background?
Yeah, that's part of our, I don't remember exactly when we took it, but we always take on an annual or every couple of years we take training. An example is certain cultures don't like you to look them straight in the face. It even goes down to touching women and other things like that. Because we are in medicine, we have to. Sometimes we can get very
And now you said earlier that sometimes you have a partner that may speak Spanish or,
Right.
or something. How would you handle other language barriers? Would there ever be an interpreter available?
Well, there is, and a lot of times the best person to go to is the youngest in the crowd, because normally they're in our school districts, and even though the parents don't speak English, the child does. So normally we're sitting here talking to this adult patient through their children, who might be only 6 or 7 year old, maybe even younger than that, and they're answering all the questions or interpreting for us. So that's, if my partner doesn't speak Spanish, that's our first place to go, is to somebody there that does speak English.
Are you learning a second language, or do you plan on learning a second language?
Well, I took some college courses in Spanish. I didn't do so well. Well, I did well in the courses, but I didn't do so well at retaining the information. But my wife's Spanish, and every once in a while she's trying to drill it in my head. But I do know a few sentences here and there, but it's not sporadic. So.
Are there brochures or pamphlets or any other materials or forms that are in other languages?
Yeah, every form we carry is in Spanish. It's in Spanish or English. We don't have anything outside of that. And that's everything from our against medical advice forms, where somebody refuses against medical advice, to our refusal forms, to domestic abuse information, the number of things we carry in Spanish.
Do you feel that gender plays a role in how you communicate with others on the job?
Yeah, how I communicate, not really. I mean, we have basically a set of questions we ask everybody in the way we communicate with them. Where I think there's a difference in communication might be between a child and an adult, but as far as speaking to a male or female patient, it doesn't really differ in the way I communicate with them.
Do you feel that so would you say that age is something then that?
Yeah, age is, because the younger you get. Now, adult patients are all pretty much similar. And as the patient gets older, sometimes they revert back to childlike characteristics. So then, I would say extreme young, extreme old those would be the populations that you would have a different communication approach.
What role do you feel that nonverbal cues play in your?
Well, quite a bit. When we look at somebody, we determine the signs and symptoms. Some of the signs might be grimacing, might be them holding their stomach, their chest, universal sign for choking. I mean, there's a number of ways you can communicate without verbal communication, and we do pick up on that right away. So, yeah.
How did you learn to interpret those nonverbal cues?
Well, one, I could probably put some of these symptoms in front of, if I'm holding my belly in front of a 10-year-old, there I know my stomach hurts. So a lot of it is just common sense. And then some of the symptoms some of the things that we see, we actually were taught in school that these are examples of somebody having difficulty, and that would be, like we know when we walk into a house and somebody's in a tripod position leaning over, normally they're most likely having something along the lines of emphysema, congestive heart failure from a respiratory distress, and they lean forward. And that right there tells us right when we walk through the door, that's a visual cue that this person's in bad shape.
Do you see yourself still in this profession until you retire?
Probably a different aspect of it, probably an administrative or supervisory position, maybe not even maybe not a paramedic, but as a nurse practitioner.
And if you were to make a call and realize that the patient was somebody that you knew, would you feel that it would be more difficult to take care of them?
No, because we're there to perform a task, and if we don't do that task, that could be that person's